my name is Charlotte Handberg and I work as a senior researcher at the National Rehabilitation Center for Neuromuscular Diseases in Denmark. And then I'm an associate professor at Aarhus University. The medical treatment for SMA was approved for people under 25 years last year. So we decided to do an interview study with the parents regarding hopes and expectations and uncertainties related to medical treatment. So we did an interview study where I drove around the country, visited the families and interviewed either the couples or the parents that were at home. I interviewed 26 parents to 20 children. And one couple had 2 children with SMA. For the methodology, I used interpretive description, which is a methodology where we seek to improve clinical practice. So the findings will be used to improve and target our rehabilitation services for the families because medical treatment is so new in Denmark, so it's a whole new group of children growing up. So we want to target our rehabilitation better for those families. So I asked questions relating hopes, uncertainty, which medication they were receiving, how it worked, and also if they had any side effects and what were the expectations regarding the future, and also right now, if you could say that. So overall, we found results regarding hopes and uncertainty because there was medical treatment. They have a lot of hope tied up to that, you could say, which is new for especially the newborn screen that also was included in the study. And also for all the families, we had children from 14 years and below included in the study. So some of them had received treatment later and some of them had received it at an early age. So of course there was some differences in the findings for the groups, but still the medical treatment really carried a lot of hope for the families that there was something that you could do, and especially for the newborn screens that had SMA1, type 1, which we didn't have treatment for those earlier. So there was a lot of hope tied up to that, you could say. But still, all the families, and also for the older children, they talked a lot about the uncertainties, not only to the effect of the medication, but also to what's going on in the world. Would they keep getting the medical treatment, and what treatments were available, and was it perhaps better to have the gene therapy because it was a one treatment? So if, for instance, there would be a war in Europe and they wouldn't have the available medication, then they would have, one go and that would be it. So there was a lot of uncertainty around that, but also about the disease progression and would it get worse even though there was medical treatment, and how they were to go around the training and all the compliance around the medication. And then we had also findings related to normalcy and what is a normal life and what is a normal family life. And if you had, for instance, some of the families had children that didn't have SMA and then have a younger child that had SMA, and what it meant for the whole family to suddenly have a child that needed special support, and in that way it affected the whole family. And of course also for the families that were expecting a child and then they had a newborn screen child, and so they went home from the hospital and then they got a phone call maybe the day after or 2 days later and got a message that we need to see you at the hospital, we have something serious to discuss with you. So these families, that was a big shock of course for them. They had went home with a healthy child in their mind, and then they had the screening and found out that their child was severely ill. So regarding normalcy, they had this unexpected turn in life from a pregnancy where you didn't know that you were going to get a child that was ill, and then suddenly a whole new situation. But also adjusting and adapting to that new situation and gaining a normal life in that situation, you could say. For the final result, or the last was regarding the need for role models. Role models at the same age of the child, the families were talking about, but also role models for older children, so they could see what I talked about earlier was, what's to expect and what will this life be like for our child. So to see somebody maybe grown up or a teenager and see, okay, this is how they go about life, and that could bring a lot of hope for the families also, to see that you could manage manage well and do well in life despite having a severe disease. And what was also a very important finding was that the families, and that's what we're really going to look into in the rehabilitation service at our hospital, is that many of the families mentioned that overload of information was difficult for them to manage, and especially when the child was young, and the health professionals in a good way wanted to share all their knowledge and counseling, and the families just said it can take away the hope from us. So we little bite, not too much, and let us keep our hope, even though we know it's a severe disease, but don't overload us with information at once, but let us get it bite by bite. So that's really something that is difficult for health professionals, because it's difficult for each family, you could say. So some families would say it's okay, just bring it on, we want to know everything, but many families said not too much. So how to find that balance is something that we are definitely going to look into.